From across Maryland, Virginia, and the District, this is Washington's 24-hour local news leader. News Channel 8's Live This Morning starts right now.
7 minutes now before 11 o'clock. A remarkable statistic leads off News for Medicine's Cutting Edge, and that is that more than half of the women in this country don't receive or delay the medical care they need. Some women go for decades without getting a checkup. Our next guest is a nurse practitioner with the DocTalker Family Practice in Northern Virginia, and Valerie Tinley joins us to talk more about getting women the medical care they need. First of all, it's great to have you here. Thanks.
Thank you for having me.
Thank you so much for joining us, Valerie. What it turns out to be is the person in the family who generally makes the health care decisions for the rest of the family is the one who herself most often delays getting health care. Mom will make sure that the kids and the husband get an appointment and to those appointments, but she'll put off getting medical care herself.
That is so true. After many years of looking after females, I'm quite aware that they put themselves last.
Why is that? Is it just because it's sort of, you know, the nurturing thing, I make sure everyone else, gets this before I worry about it, and then it's a little easier to put it off? That's
very true. But I think research shows that it's also cost related, which I think for single females without insurance is really a problem. It is also a problem trying to make those appointments if you're a working woman or a single mother. And there are many other reasons why people don't do it.
And you have been, because you've been watching this for a long time, one of the things you do in your practice is make yourself available.
Correct.
At those different times so that women don't have that excuse anymore.
That's true.
I'll be there when you can see me.
Yes, and that's exactly what we did. We developed a women's health clinic. We rotate days and we rotate times. You can see us before work, you can see us after work, you can see us during the day or on Saturday. In fact, this Saturday I do have a patient on for a women's health visit. So
let's talk a little bit about why this is so very important. When we understand the need, you know, maybe if your husband is put on some pounds over the years, has a sedentary job, doesn't exercise as much as he should, that woman is going to say, you need to be seen because I'm worried that you'll have a heart attack or something like that.
Correct.
Well, the threat for heart disease is just as great for that woman as well.
Absolutely, absolutely, which is obviously recently big news and ongoing. For many women, their health needs changes considerably over the years, from menarche to birth control pills to childbirth to menopause, well, to dealing with the stress of a family, and also menopause, and often being sandwiched at that point in between two generations. It is important because people sometimes put stuff off thinking they know what it is. Women who are menopausal, thinking they're menopausal, let me give you an instant. We have a lady who was menopausal, thought she was menopausal, was having problems with weight gain and bleeding, irregular cycles, did not seek care for at least many, many months. When she did, she came in, the follow-up showed she wasn't menopausal. She actually had a large fibroid, she was anemic, and her fatigue was because of all of this.
It points up the importance of not guessing, but actually getting a medical professional to tell you what the problem is.
And
thank you so much for joining us.
Yes, you're so welcome.
I really appreciate it. Valerie Tinley of the DocTalker practice. We'll be right back. Hope you are too.